300 women in Ireland are diagnosed with cervical cancer every year, while many more will deal with abnormalities. This week marks Cervical Cancer Prevention Week, which aims to make women aware of the signs and symptoms of the disease.
We're joined now by cervical cancer survivor Sharon McGeough, along with consultant obstetrician and gynaecologist Dr. Cliona Murphy. You're both very welcome.
Thank you.
Sharon, you were one of the 300 in September, in 2017, you were one of those 300 women. Tell us a little bit about your diagnosis then.
Well, basically, I had a big fear of smears and I got my letter every 3 years, threw it in the bin. And then I started to bleed and my husband and my sister both said, you have to go and get checked. And I had my smear and basically on the 12th of September, I was told I had cervical cancer. So.
What was that fear of the smear? Where did that come from?
I'm not sure. I think it was just like a medical thing and just a privacy thing. You know what I mean? It's so intimate and, you just put it off. Oh, I'll do it next time, I'll do it next time. And it's not a comfortable thing. No one looks forward to it. No. So I just thought, oh, sure, I'll be grand. So it wasn't.
And you weren't, and you received the diagnosis. And what treatment then?
Well, they had to check and see if it went to my lymph nodes. So I had surgery on the day of stomophilia, the 16th of October, and started my treatment then. It had gone to my lymph nodes, so I started radiation and chemo on the 20th of November in the same year in St. Luke's.
And that continued for months until?
Till mid-January the next year.
And in April last year, you received the all-clear?
Yeah, just before my 40th birthday, so it was a great birthday present.
Yeah. And all well now? How are you feeling?
All good, yeah. Regular checkups every 3 months up to St. Luke's, and they're brilliant up there. They really are brilliant. But yeah, all good, all good.
Given what you've been through, and whatever your block with the smear test was, I don't know, have you got daughters yet?
Yes, I have a little girl, yeah.
OK, yeah. I'm assuming that given what you've been through, you will make sure that her cervical health is
100%.
100%.
Yeah.
And if you had your time again, I mean, whether it was irrational fear is neither here nor there. That's how you felt, and that's what you did. But looking back on it now, do you think, God, how could I have allowed that to happen?
It's so quick and it's so easy. The nurse did my original one. They're so reassuring, and it was over so quickly, and now I have to get checkups every 3 months, so I have to do these exams every 3 months, whereas if I had to wait for my 3-year ones, do you know what I mean? But of course, as I go for every letter.
Yeah, sorry to cut across you. Anecdotally talking to other women, was that fear common? Were there quite a few other women who felt the same as you? Yeah,
there would be the big girl that I work with, and she was the same, you know what I mean? But to come out the other side of it now and to say to people, that it's not as... It genuinely... Your mind makes it worse than it actually is.
But when she heard your news, she ran down and got it done.
Well, that's it, 100%. 100%. I haven't spoken to one person now that said they haven't had their smear. Said, that I know, they're all going for them. So that's the other side.
Dr. Murphy, putting it on the long finger, or maybe being afraid of it, is that a common occurrence with the smear testing?
It is really. The cervical check has screened over 1 million women and has been quite successful. However, we do find that the younger cohorts, actually from kind of 25, 30, are quite good at going for the smear test. They see it as kind of a normal thing to be doing, because they've actually grown up with the screening programme. Slightly older cohorts, and certainly women over 40, that we would find that there's a drop-off. And maybe married women with children, they're busy, they think maybe it doesn't apply to them. And also, I suppose, mums prioritise everybody else's health, but not necessarily their own, so they'll be bringing their children to the dentist, etc., but often it's their own bits and pieces they don't get done.
Women are anecdotally better at looking after their health than men are, and quite often they're better at looking after our health than we are as well. But is this an area of women's health where there is still some embarrassment or reluctance? Or
I think so, and especially, as I said, if people haven't been used to having regular smear checks, they're a bit squeamish about it, they're a bit worried about it. It is an invasive, procedure. It isn't quite like going to the dentist. But I think once people have their first smear test and it passes off without event and people are nice to them and it's not as uncomfortable, then people will come back. So in our clinics, we would find that it's very important to talk people through it, that to give them privacy, to be very nice, so that they'll come back the next time. And mostly that's what we find. That
Well, look, it's a very intimate examination, obviously. Was the fact that for women of a certain generation that this examination was performed by men, was that another factor, do you think?
That may well be, but also I think in Ireland we haven't been very good with kind of sex education. We haven't been maybe as good as people on the continent, as about talking about these things really. So I think there's certainly a degree of reticence and kind of prudishness in Irish women. All of us, professionals, ordinary, So I think we're getting past that and people are becoming more open, but there's still a remnant of our past where at school, we barely got any sex education at all. So I think that's certainly a factor.
You weren't even allowed to refer to it, let alone have it examined, And I'm not being facetious here, because I'm of that generation. You couldn't, for all the wrong reasons, have had any more publicity about cervical cancer than you've had in the last year. What has that done in terms of awareness and also in terms of people getting their smears and becoming more aware of their cervical health?
I think it obviously it's been very distressing for people involved, but it has had a very positive effect on people coming for smears. So we have had, some great patient champions like Sharon, so Laura Brennan and Vicky Phelan, who've emphasised that it's really very important to get your smears done, and that screening has saved lives and continues to save lives. As I said, over 1 million women screened. We are seeing rates of cancer falling annually. I mean, not as much as we still would like, but it is effective. So there's 3 kind of ways to reduce cancer burden. One would be vaccination, and again, that's been in the news, and people have now realised it is, prevention is much better than cure. Secondary would be screening and trying to pick up things at an early stage. Even if you're to have cancer diagnosed, the smaller it is, the easier the treatment is, so that maybe somebody else doesn't have to go through what Sharon has gone through. And then early detection, so being aware of the symptoms. As Sharon said, bleeding after intercourse is not normal. Bleeding in between periods could be normal, but often isn't, so it's very important to get checked up. It doesn't mean you have cancer, but you need to check it. And bleeding in somebody whose periods have stopped, so postmenopausal bleeding, is really very abnormal and cannot be ignored. And these are the things we want to get across to people.
Sharon, with that, all the publicity over the last few months, you were obviously finished chemo, but you were going through kind of the recovery stage, trying to get over it. What was it like hearing it on the news, kind of being confronted with it publicly every day?
It just made me feel even luckier in my situation that through, look, shoulda, woulda, coulda, but through my own fault, had I had my smears, it wouldn't have probably developed into full cervical cancer. But looking at Vicky Phelan and the other ladies, it just made me feel so lucky that, from having that one smear, that it was discovered, I'd had my treatment, and I'm out the other side of it now with my 3 kids, and you know what I mean? It just made me feel it was a good thing. I took it as a positive thing, that I was so lucky.
And you're taking a leadership role now in this week, kind of looking at cervical prevention.
Hopefully people listen to me.
The ounce of prevention always better than the pound of cure, Cliona. The HPV vaccine has been very controversial, still continues to be, and it is remarkable that when you meet Sharon and you meet Vicky and other women who in some senses the system failed, which is why they ended up where they were, are still so resolutely in favour of it and absolutely adamant that the HPV vaccine should be taken up by young women.
Absolutely, and the evidence, worldwide evidence shows that HPV vaccine first works, and secondly, that there's no increase in adverse events in, girls who've had the vaccine and girls that haven't. So the evidence is there. We had very good coverage for a number of years and then it dropped down, but that now is turning. So we had dropped down to about 50% coverage. Now it's gone back up to 65%. So I think the message has got out there that this is really important. In countries where they've had HPV vaccination for a number of years, they have seen HPV reduce way down. So that has to be good, and it will reduce the burden of disease. And also there's been a discussion about HPV involved in other cancers, so in cancers that affect boys and cancers that affect head and neck. So there will be a knock-on effect for other cancers as well. That will.
Can I ask you, how did we get to that stage? I have two daughters. One is 20 and one is 14. And when the 20-year-old came to the stage where she was offered the vaccine, there was little or no debate about it. It was, no, we discussed it with her and we laid it out and she went, absolutely, I want to go for this. By the time we got to the 14-year-old, there was a debate, and my wife was involved in it, just personally in her own Facebook group. But there was, I don't know, 50, 60, 70 women mothers. And the debate raged for weeks. And there was a lot of kind of hot and heavy discussions in our house about it. How did we get from, absolutely, this is a great idea, we must do it, and it's a no-brainer, to long, painful, protracted, and quite divisive debate? How did that happen?
Well, I think there's you know, in a lot of countries there's been an anti-vaccine movement, and that has spread. I mean, it's spread from the US over to Ireland. We're no different. You know, and then people, I suppose, doing their own research, inverted commas, online and finding things that, you know, essentially backed up. But it's not correct research. It's not evidence-based medical research, you know. And I suppose there's so much information out there, it's very difficult for people to see the wood for the trees. And then, you know, stories of girls fainting and being unable to go to school, nobody wants to inflict that on their children. So I think that was very difficult for parents. I certainly see that it was difficult for parents. But I see there has been a change in social media now, and that people are accepting it. And interestingly, in Japan, where unfortunately their government did not stand up and they let, you know, vaccination drop and the rates are very low, they now have seen an increase in cervical cancers in the last few years. So, I mean, I think we're lucky in this country that actually political leadership, medical leadership did stand up and say, no, you know, vaccination is very important.
It has to be said that that anti-vaccination movement arose from, I'm not particularly one man, but Andrew Wakefield particularly, with the MMR vaccine about measles, obviously. And he has been proved to be
thoroughly debunked.
an absolute chancer, a charlatan. But still, the legacy of what he did is costing people's lives.
Absolutely. And, you know, a lot of it is kind of anti-establishment, you know, kind of conspiracy theory. And then there's a very insidious role of, you know, the far right and people linking, you know, HPV vaccination. If you vaccinate your child, they'll be promiscuous. None of that has any evidence, but that has come, you know, from certain groups in the US. So,
sure, even as you say those words out loud, you realise how ludicrous, or you should realise how ludicrous it is. Listen,
if people want to read more about it, there's a fact check on the journal.ie about, and it runs through all the evidence about the HPV vaccine.
Okay, this is the Awareness Week this week. If people want to get more information, they can go to www.cervicalcheck.ie, and also the Cancer Society has good information and links from them as well. Yeah. Most of all, we want to say, Sharon, it's lovely to see you looking so well.
Thank you very much.
Congratulations.
My daughter will have the HPV vaccine.
Well, endorsements don't come any better than that, do they? Let's take a break. We'll be back for more after them.